We're on location, and we have a special show for you. From the shop, Bras for Body and Soul, it is Voices in Health. Welcome to Voices in Health. I'm Dr. Barbara Kostick. Here at Washington Hospital is a unique service for women. It's called Bras for Body and Soul, a specialty shop for women who have had breast cancer. But it is more than just a shop. It is a part of the HERS Breast Cancer Foundation, and it provides comfort to all, both physical and emotional. For breast cancer survivors, the shop is right here at 2500 Mallory, and it's the destination for understanding, empathy, and support. A breast cancer diagnosis can be a lonely journey, but for the women of Bras for Body and Soul, the gap is shared by sharing their own experiences and listening to other women's stories. Joining Voices in Health is Dr. Vera Packard, Executive Director of HERS Breast Cancer Foundation, and Elaine Skloot, Bras for Body and Soul Office Administrator. Welcome, Vera and Elaine.
Thank you.
Vera, can you tell us about Bras for Body and Soul, the name, and HERS Foundation?
Yes, absolutely, Barbara. Bras for Body and Soul is the main program for the HERS Breast Cancer Foundation. And what it is actually is bras are the tools, but the main goal is to help women who had breast cancer to achieve their self-esteem and to recuperate and to feel good about themselves. So it's all about them and about their soul. And so it's much more than just the tools that we use here. So it's a program for the foundation, and we just would like to increase and let this wonderful community of Fremont to know what we do here.
Well, and Elaine, you had personal experience as a breast cancer survivor, didn't you?
Yes, I did. As a matter of fact, it was over 17 years ago that I was diagnosed, and I had an excellent surgeon, an excellent plastic surgeon, but no one told me what to do after I healed. Mm-hmm. And then I had to go to search for something myself that would make my clothes look better when I put them on. And so I did find a little shop that had some things, and they said, well, if you can find something, help yourself. Mm-hmm. And so for about a year I struggled along with that. And then I happened to be in a second-hand clothing store here in Fremont, and I saw a brochure that said Bras for Body and Soul. And so in the brochure, it said that they could fit me with mm-hmm. prosthesis and with special bras that could make me feel like I was the same person I was before. And so that's how I met the founder of Bras for Body and Soul, and I've been with them ever since. And so I luckily am also able to work here now.
Well, who do you think should be the customers at this store?
The customers really are any woman who wants to have good breast health. But actually, we want most to serve women who have had mastectomies or lumpectomies, women who are going through radiation or chemotherapy, because we have wigs and hats and scarves for them, whether they've had mastectomies or not. Mm-hmm. We also always want to serve women who have lymphedema, which is not a very well diagnosed result often of having lymph nodes removed, which happens very often with women with mastectomies. So we provide those products as well. So we really just want to serve all women, but the most important are the women who are sent here to us, and our goal is to have them come before their surgery.
So if a woman gets the diagnosis that she may have breast cancer or may have to have surgery for possible breast cancer, then this would be one of the places to stop at, just like stopping at their doctor's office to get their checkup on what they'd need. Huh?
Absolutely. And it's a very fortunate woman who has a surgeon or a plastic surgeon or an oncologist who says, what I want you to do first is go to Bras for Body and Soul. They'll be able to help you. And that's exactly what we try to do. We're not sure who's going to walk in the door each time. Are they a person who just heard about that they're going to have a mastectomy next week? Or was it 25 years ago and no one's ever told them that we exist or that a place like this exists? So we're always ready for that person to come in and ready to listen to what it is they need so we can help them.
And Vera, what's your background now?
Well, I'm a former breast cancer surgeon. Actually, I practiced medicine for 20 years in Brazil as a breast cancer surgeon and moved to America because I got married. So the things you do for love changed my whole life, and was looking for something interesting to do that I could bring my background. But I didn't want to practice in this country, and lucky enough, after being here for 5 years, I found this place, and I think they found me. It was a good synergy. But I just, with my background and on my 20 years of practice, I just wish that something like this would exist everywhere. And it's interesting to know that not even here in America, there's not other bras for body and soul. And that's the goal for the HERS Breast Cancer Foundation. We really would like to maybe in the future have other service programs like that in other hospitals, but also in this Tri-City area. We really would like the doctor's office to know, the nurses and assistants that work there, so they can put our brochure together with all the paperwork that the patient needs to do, so they can come here right in the beginning. We can really help them from the get-go. And I know as a physician, former physician, that would make a difference for me, taking care of that woman. Yeah. And I just feel blessed that I end up in a place like this and help to make it grow.
So what are the goals of the HERS Foundation?
The goals of the foundation, we are a young foundation, and you say that like we are a teenager. We've been around for 10 years, and our goal is really to help this service that we do here at Bras for Body and Soul, which is our main program, and help this service to be available to every woman. We do all the women who have insurance, and we take care of all that burden for them. We fill out all the paperwork. We take care of everything for them. But we also will start serving, and we'll serve more and more the underserved in this community, developing relationship with the Washington Foundation, with the Tri-City Health Centers, other organizations in this area that assist the underserved. And so we can partner together and develop provide this kind of products and service to these women as well. So that is the main goal, and to let this community know what this service is available. And very interesting, Barbara, we did research, and there's not any other nonprofit organization in the Tri-City area who does specifically what we do. So we're very proud of what we do.
Well, you know, this is the first time I've been on location in a shop. Is there a reason we're here now?
Yes, there is, and I'm very proud to say we did some remodeling recently, and it was basically because, and you know, it's interesting, people say shop, and then of course it comes this idea of a retail shop. And yes, do we sell products? Absolutely. But what we do is we serve. And the idea of the remodeling was not only make this more of a service location where the woman come in here, she will get her tea served, she will have a warm and comfortable place where she can get to wait to be served by our bra specialist, but even to bring up what HERS mean. And HERS is an acronym for hope, empowerment, renew, and support. And we even got here on our walls these words painted, because that's what we are. That's what we do. We give people hope. We empower the women that walk here. We try to renew their body and the way they feel, and we support them with whatever they need.
I think it's really important to know that over the history of Bras for Body and Soul, we were in a lot of little places in the founder's home, things like that, and the women got very used to that. And then when we moved here, they were a little fearful. Was it going to be now suddenly medical because we were in a hospital? And they were so thrilled when they walked in and said, "Are we really worth this?" And it's true. All women are worth it. They are worth this approach, and they're worth the service that they get here. And I think many women walk in with that look on their face. What a nice place to come. And that's part of the service.
Now, Vera, you touched on something about filling out the insurance forms, because it's very difficult to figure out what exactly you're entitled to under all the different insurance plans.
Absolutely, and that's one of the biggest service that we provide. Actually, it takes, it's very interesting, it takes 6 to 8 hours from the time that the woman comes here and gets fitted. It would take usually 45 minutes to an hour to the time that we bill and get payment from the insurance. All the work that goes behind and that with, you know, billing and getting back, and this is not appropriate, and we do all that work. And beautifully, we even do with wonderful volunteers that come here and help us with all this insurance billing. And it's a lot of work, and being in the medical field, you know that's a totally different industry than just taking care of a person. It's a whole bunch of other things that needs to be done, and we do all that. And we are now even going through a process to get accredited, which is an accreditation by the federal government. And so it's just kind of adjusting to make it, it's all good, we're just making it better.
So Elaine, why did you get involved after you got your prosthesis and your profiting? Why did you get involved with the program?
Well, when I retired from the corporate world in 2000, I went to the shop to get some product to go on vacation. And at that time, I said to the founder, you know, you haven't changed your prices in 5 years. I think you need some help. And she said, okay. And so after my vacation, I came back to volunteer because I had, in my previous career, done a lot of insurance work. And so I felt that that was very apropos. And so I really worked for about 3 years as a volunteer. And then finally, I now call myself a paid volunteer.
Well, what kind of things do you look for in volunteers?
I think, speaking for myself, it has to have, the person must have passion. They have to have passion for the work. It doesn't mean that they've had to have had a mastectomy or have had breast surgery, but they do have to have those special feelings, that special interest in other people, that history of caring, because that's really what we do. It's the soul part of the work, and you have to have that. It's a certain spirit that the person has to have to be here.
And Vera, don't you think Elaine has that spirit too?
Oh my word, it's Elaine is my right hand, my left hand, everything here. She is, and you know, Barbara, it's very interesting that working here, when I first got here, I had this meeting and asked everybody, why do you work here and what's your feeling? And I've heard the word love so many times because I love to wake up and come here. It's a wonderful place to be. I just feel good when I come here. So it's a blessing for me to work with people like that, volunteer and staff. Everybody's just passion of what they do here, which is take care of people, take care of women.
This is my linear accelerator.
This is my cardiologist.
This is my CT scanner.
This is my surgical tray.
This is our registered nurse.
This is my digital mammography center.
Washington Hospital is not owned by a corporation. It is owned by and open to everyone in our community, including you.
This is my hospital.
This is my hospital.
This is my hospital.
Mom?
Dad?
How long should I wait for you?
If I'm at soccer practice.
What if something happens? Will you come get me?
There's no reason not to have a plan in case of an emergency.
Should we go to the neighbor's house?
And some extremely good reasons why you should.
Can you tell me?
Talk to your family about what you would do in case of an emergency. For more information, visit www.ready.gov.
Flannel pajamas get rid of a cold 20% faster. You can clear up pink eye by watching black and white movies. I put garlic around the kids' necks. They stunk, but they were healthy. I raised 3 kids. I think I know a thing or two about doctoring.
Presenting the InHealth channel, a much better source of information on issues affecting your health and safety. Brought to you by Washington Hospital.
You're not even listening to me.
Bras for Body and Soul provides products and extended services for all women in the community. It is a calming, colorful place where women can find comfort and support. Products specifically designed for women who have survived breast cancer include post-operative camisoles, standard and custom silicone breast forms, specialty bras designed to support the breast forms, wigs and head coverings, swimsuits designed to support breast forms, and maternity bras. Every woman feels comfortable knowing they will have a private, individualized fitting with a breast care specialist. Joining Voices in Health is Polly Sherman. Welcome, Polly. Tell us what a breast specialist does.
A breast care specialist is someone who's been trained extensively to properly fit all women with bras in some cases, and prosthesis in other cases.
And do you handle a multitude of problems then too?
Oh, yes. We take care of lots of clients, from women who are nursing to women who have radiation burns who need a good fitting bra, to women who have lymphedema and need a compression bra, women who have had non-surgical cancers or non-cancer surgeries who need to have a special bra. And then, of course, we do our main mission, which is to take care of women who have had breast cancer.
And do you have any special training or certification for that?
Yes, we take classes from accredited schools, and then we also are trained for about 500 hours with a certified fitter.
And Barbara, just like to interject and say that Polly is also a former nurse, and so she has that background also of taking care of people, and also like we are going also through this accreditation process, so we're going to be completely certified for all of our specialists and the program itself.
Well, let's look at some of the things that you have here in the store.
Okay, I have actually mentioned women that were going through, needed a good fitting bra that did not have cancer. However, as I said, our main mission is to help women who have breast cancer. So basically, there are a lot of different products. One of the products that we love to be able to fit women in is a post-surgical garment that they can get before they have their surgery, and they can wear it after their surgery. And basically, it's a very soft cotton bra camisole that has no seams inside, which make it very comfortable, and then it comes with puffs. So if they have just a single mastectomy, they can put the puff in there, and then their natural breast would be on this side. And then if they had a bilateral, they could have 2 puffs. And that way, when a woman comes out of surgery, she can put this on and immediately start to feel better about herself. And especially women with young children like to have products like this, because it's very scary for the young children to see their mothers, you know, where it's very obvious they've had their surgeries. So this is a lovely product. There are different ones. Here's another one I wanted to show you, and it's just like a shorter version, and it's whatever the client prefers. But the nice thing about this one, it can be used for, you know, when they're recuperating, but also it has a drain attachment, and there's 2 of them here like this. And then once you're done with them and you don't have your drains anymore, you can just take them off. So there are lots of different options. And basically, we just try things on, and until a woman decides, you know, this is the one that works for me. The other thing we have, I'm showing you white, but some of these camisoles come in beautiful colors, which sometimes is just what a woman needs. You know, just a little bit of color when they're feeling really low. But this is the ideal situation, is that we have a doctor that sends their patients to us, and they can have these and use them right after surgery.
Well, and they could get fitted ahead of time, because it's probably painful after surgery, and it'd be nice to know that it fits and not have to try on 2 or 3 different sizes.
It doesn't happen. They get busy, they are not feeling well, and they never come to get their products. So we always encourage them to get them right away, and then they have them. And it's just it's something every woman deserves after going through surgery.
Now, are there different kinds of prostheses that you put inside them?
Oh, yes. Well, now these are for surgery, right after surgery. They're as different as there are women. So we have different colors. We actually have a tawny color for women of color. Some prefer them, some don't care. We also have, and there's beige, but there's different styles, there's different sizes, there's different shapes. There are different materials. So this one happens to be a whipped silicone. It's softer and a little bit lighter. This one happens to have some silicone in the back too that kind of adjust to the chest wall of the woman. So, you know, not all surgeries are flat. And
well, some women don't have flat chests. You know, their ribs can stick out. So it would be very uncomfortable to just lie something heavy on those ribs after
Absolutely.
surgery.
And what we try to do is try lots of them on and see which ones feel better. We have our recommendations that we give to them. However, they know it when it feels good and when it feels right. Now there's this is actually a triangle shape, but there are teardrops. There are shapes where you actually, asymmetrical, where it goes to the side like this. And so, because some women have tissue taken out underneath their armpit.
Some women don't have their whole breast removed either.
Absolutely, and that is actually more and more common, but it can be troublesome for a lot of women. And so we have things that are perfect for that. One is a shell. So basically, this is nice because you can fill this with a little bit of fiber fill so that it can match perfectly to your natural breast. So it's just a shell that goes over your breast, the one that has had the surgery, and so that you could wear a nice sweater and look symmetrical and balanced, and that's really what we're looking for.
Well, and as you said, you don't have to be a breast cancer survivor. There are a lot of women that have different sized breasts.
Different size, and some of it is actually a medical condition where it can be two sizes different. One side can be an A, one side can be a D. And I'll tell you, it's really a pleasure to help those women.
Yes.
Because they have suffered many, many years, some of them. I mean, since maybe grade school, when they first started developing, and to feel comfortable and symmetrical is just the greatest thing in the world to them. They just didn't know these products were available. And you know, this is silicone, but we also have them in like a foam or a fiber fill, which they can be very inexpensive. So a lot of women like the silicone because it feels real. If someone were to hug them, it would feel real. However, you don't have to have something like this. We can work with you, and if you need a little cheaper option, that's okay too, because insurances don't cover some situations. So.
And again, you help with the insurances, and if there's not insurance, you would help them too. So.
Yes, absolutely. And I think what's important to say also is, like, as everybody knows, the surgery for breast cancer has evolved and changed so much, and women are having less mastectomies and other big surgeries, but there's a variety of surgeries that can be done. And these providers for this material, bras and prostheses, this company have improved so much. They just have come up with wonderful and different products that fit every case specifically. And unfortunately, not most of the doctors know about that, and their managers and assistants in their office don't know. So if our goal is really to let in the Tri-City area, the doctors who take care of these women know about us, so they can send the client here, and then we can help and even show different options of prostheses, which will probably help them even to decide what kind of surgery to have. Like Polly showed the lumpectomy prostheses. I think you have it right
here. Oh, yes. So now this is a little bit bigger, than obviously I'm showing smaller ones, but sometimes if someone has a lumpectomy that's on the lower part of the breast, all they need is a little something underneath like this, and there's also a one that goes on top. So basically, we can just tweak it. You just need the right,
And as you said, you're going for symmetry. You're
Absolutely.
going for the one side to look like the other
Absolutely.
side.
And all of these products are sold with a pocketed bra. The prosthesis and also the shells can go into. And so you just put them in here like this. And they are held in there very securely. Makes a woman feel good about that.
Well, you know, it's a very private thing, too. Is this a private exam when you do it too?
Oh, absolutely. When a woman comes in here, one of the first things I do is take her right into my dressing room, where we can sit and talk, and I can find out what her needs are. And we have lovely little robes, because nobody wants to be in a dressing room with their shirt off. So these are nice, pretty, silky robes that women put on in between fittings, so they feel, that their privacy is being maintained.
That sounds wonderful. How can the community help with this?
Well, it's very interesting because we would like to help all the breast cancer survivors that we can, but any woman in this community can come here and shop with us for bras, for hats, for scarves, for anything that's necessary. And what happens is all the profits from these sales will help with our mission to serve all women with breast cancer. So this community can get high quality products, because that's all we carry, very high quality products, and get a wonderful fitting by Polly and Aurora and Sally, our other bra specialists, with a private room, and get the right bra for them. And at the same time, they're helping our mission to serve the breast cancer survivors in this area.
And then we talked about also that other things happen to breast cancer patients besides losing part of their breast. Sometimes,
you know, that was one of the most amazing things when I came here, to see women who are struggling with breast cancer, but really and truly, hair loss, huge for a woman, huge. So we really heard that, and we have a stylist that we have on our staff, who we give a card out to them. It's got her cell number. They make an appointment, and we do wig fittings. She not only does the wigs, but helps them fit, but she'll style it, she'll cut it, and so that they feel comfortable, you know, losing their hair. And we also have turbans and things like that. The other thing that's difficult for a lot of women is lymphedema. And lymphedema is unfortunate if you have nodes removed. It's a swelling, and it's uncomfortable, and it's just a very hard thing for women to deal with. And so we have garments. Doctors give us prescriptions, and they are fitted, or you know, they're fitted, and then we provide the garments. Some women get these prophylactically to help them from getting lymphedema, but certainly once they have them, we have the garment. Now there's sleeves.
And it's because of the surgery under the arm and the underarm lymph nodes that's where the lymph goes from the lower part of the arm up into the chest. So if you don't have that road, if you've taken out those nodes, then the lymph builds up, and that's what the swelling's due to. So you're saying by compressing that area, it keeps the lymph from building up and making them uncomfortable. Yes,
because it's very, very distressing for a woman who's had breast surgery. Now all of a sudden she's got this swollen arm too, and sometimes she didn't even know about it, and it's very difficult. So these products help.
And provide these lymphedema garments actually is a wonderful partnership with the Washington Foundation, and together here with the Women's Center, where there is a lymphedema clinic, so they can see the patients there and then send them to us already with, you know, with the right prescription. And so we have this wonderful communication. And we really could only start this program because we're having this relationship with the Washington Foundation. So it all comes together, like, you know, and I truly believe that that's how things get better in this world, is when you partner and do things together. And we're just very fortunate to be able to do that.
And you said, what does HERS stand for again?
It's hope, empowerment, renew, and support.
Washington on Wheels brings health services to people in the community who otherwise wouldn't have access to quality health care. And take it from us, there's nothing more frustrating than being denied access. To find out when Washington on Wheels is pulling into your community, go to our website.
You want to fight childhood asthma? Fight it with a bear. Fight it with a duck. Fight it with a wrench. You can fight childhood asthma by tossing Teddy in the freezer to wipe out dust mites, by drying off bath toys to keep mold away, and by fixing leaks to stop the moisture that lets mold grow. Discover other simple ways to prevent an asthma attack. Call 1-866-NO-ATTACKS or visit noattacks.org, because no child should feel like a fish out of water.
Dude, you'll be fine.
There are plenty of accidents out there just waiting to happen. Fortunately, when they do, you have some of the finest emergency care available right here in the community. You be careful now.
Diane Duffy was diagnosed with breast cancer in July of 2008. She had both of her breasts surgically removed 8 months ago, and another surgery followed 1 month later. Next came chemotherapy for the junior college math teacher. Then she developed a constant fiery pain in her armpit. This mother of two was desperate and headed to Bras for Body and Soul, where they listened and offered support.
Put your seatbelts on, we're going to go to the movies.
Jackie Sweet was a 43-year-old when she was diagnosed in December of 2007. The mother of 3 teenagers came to the Women's Center for her yearly breast exam. Tests found a tumor, and 4 surgeries later, including reconstruction with her own tissue, she is now cancer-free. Welcome, Diane and Jackie.
Thank you.
Tell us how it helped you having Bras for Body and Soul.
Well, for me, it was really more about appearance. I was worried after having a bilateral mastectomy of going outside and having people, see me. My biggest concern was actually coming home and having, my kids see what I was going to look like. And my doctor referred me here before my surgery, and I was able to come in and get what they call a soft T camisole that they provided, with a special fitting for me to come in, get fitted, and then they ordered them for me through my insurance and gave them to me before my surgery. So that way when I came home from the hospital, I was actually wearing them without my kids having to notice a big difference.
Oh, that's great. And what about you?
I came later on. I had been fitted at another store, and they gave me one option. They said, here, and I said, here's my size, and they said, no, you wear this. And with the pain in my arm, it really hurt, and so I was kind of desperate, and I had heard of this place. And I came and talked to Polly, and we went through about a box of tissues and finally found something that wouldn't aggravate my arm.
Diane, it's kind of hard when people discount what you've been through, isn't it? Like what happened at the first store.
Yeah, and not to have a choice. They just said, here, you wear this, and I said, do you have white? Nope, we don't. So that was kind of singular, and here there's a lot of choices.
And a much better atmosphere, probably?
Yes, they just listened, and poor Polly just listened so much, and it was really nice to have somebody who would listen.
Well, you went through a lot. You really did, and here you are, a functioning math teacher. I mean, that's not someone who's dumb. And then to just be told, this is what you get, take it or leave it.
Right. Well, and then I just thought, this is what you get, and so afterwards I started checking out what other options there were.
And then, Jackie, you said yours were paid for by insurance. I find insurance incredibly daunting to take care of.
I didn't have to do anything. I came in, got my fitting, and I had Polly as my specialist who worked with me as well. And she took care of everything. There was a special, I guess, prescription that was written by my doctor to get the soft T camisoles. And came in, got fitted, and left, didn't have to do any paperwork, didn't have to write a check, didn't have to do anything. Waited just for a couple of weeks for my garments to come in, and then I was able to come in and get them and have everything ready to go before my surgery.
And why don't you contrast what the store was that you went to originally with what you found here, and on the basis of what's available, how much privacy you got, things like that? Can you?
Yeah, well, it was just a department store, so you just go into the regular fitting room with everybody else, and then they just said, here, you need this, and I told her what size I was, and she says, no, it has to be tighter. These things are so heavy. And she brought out these big bazookas. That's not me. And so I asked her for a smaller size, and she reluctantly got one, and that's what I got. I didn't get any choices. She said, here's what holds them, and that's it. And here, we went through garment after garment because I have this really sore armpit, and I needed something, and she found something with no seams at all, and a nice soft fabric, and I can actually wear it next to my skin, where I just couldn't wear elastic or anything, and she had a lot of things that we tried.
They seem very compassionate.
She was. She just listened and gave me Kleenex.
Well, this is a hard journey for you, isn't it? It's kind of nice to have people around that will take it with you and help you.
It's very supportive here. Yeah.
And the other thing is you're going to be a repeat customer, I assume, too, because.
Yeah, I think so. So every year I'll come back and get a new garment here, just because I know that they'll have something that's just right.
I am a repeat customer.
You are a repeat customer.
I am. One of the things that's also really nice about insurance is Polly made sure that I was aware of every year I get to come back and get another special fitting bra or whatever that is covered under my insurance, which I had no idea that was even offered. So my yearly anniversary is Valentine's Day. So every Valentine's Day I get to come back and treat myself to a garment that is specially fitted, to what I need for my particular circumstance. So it's really nice. So I just got my first anniversary,
Oh, I hope they're getting red and other colors too for you for Valentine's
Not
Day.
red, but they did have other colors, which was really nice. And Polly also spent tons of time with me. We can go back into the, the private room that we have, and I've gone through 15, 20 bras because things have changed from, now to a year ago when I went through my mastectomy. So we went through like 15, 20 bras till I found something that actually made me feel like I could hold my head high and my shoulders back and, chest out a little bit and walk tall. So it's
well, and
really
you went
nice.
through reconstruction too, so that would change what you need too, wouldn't it?
It did, yeah. I went through 2 different types of reconstruction. I went through one that where it's called a tram flap, where they use your own tissue, so that way you don't have to use implants.
Yeah.
And I tried that, and it wasn't really successful. My body had, wasn't pumping enough blood to the left side, and so we had to go in and remove it and eventually get an implant put in. So I've gone through different stages and different fittings, but the entire time what's been really nice for me is because I am a very active mother with 3 children, is I've been able to come here and nobody knows what I'm going through. Nobody knows what stages when I'm walking around, because everything I wear looks exactly like it did before. I'm symmetrical. I may not be symmetrical really, but I look symmetrical, which is really important for me. It just gives me that confidence that I need to be able to go about my daily activities with my kids.
That's right. Well, what would you tell other women in the community about this shop?
I wish that I had known, before I went through the whole ordeal. I wish I had known about this shop, and I would say, come in beforehand and find out what all the options are, so that you can find something that's right for you.
Because knowledge is power, right?
It is. It is.
How about you?
I would love to see, brochures for Bras, Body and Soul, or HERS organization in every doctor's office. I mean, I was very surprised. I knew nothing about this organization, and I live here in Fremont, until I went to my general surgeon, and he sent me here. And I am so blessed that, he sent me here, because it's just, helped me through this whole process and just make me feel, like, a woman still after everything I've been through. So I would love to see it in your oncologist's office, in your plastic surgeon's office, so that more people are aware of, what this little shop holds. It makes a world of difference to women like us.
I would say exactly what she says. If my doctor had sent me here, I would have had a much better experience. So.
And you still can come back for support anytime.
And I will, believe me.
Thank you for sharing your stories, ladies, and let's add a special thanks to our guests, Dr. Vera Packard, Elaine Skloot, and Polly Sherman, and all the specialists at Bras for Body and Soul. Well, the atmosphere here is warm and inviting. It is the women who have come together as advocates for breast health that make the shop what it is. It's a life-giving place for all who enter. I'm Dr. Barbara Kostick. Thank you for watching Voices in Health.